Doctor, I want to lower my blood pressure naturally. I don't want to take medications. Or, Doctor, I know I have hypertension, but I don't want to take drugs to control it. Can I take some natural supplements instead? Or, Doctor, instead of medications, are there foods that I can take to lower my blood pressure naturally? Hi, I'm Dr. Chan. In this video, part 1 of a series of videos that I am doing on topics related to lowering blood pressure naturally, I want to share with you the number 1 mistake that many people with hypertension, including my patients, often make when they choose to lower their blood pressure through natural, non-pharmacological means. If you're interested, watch on. Hi guys, welcome back to my channel. If you're new here, I am Dr. Chan. I am a medical doctor from Singapore. My passion is in activating and empowering people to unlock the power of lifestyle and eating habits to prevent and combat diabetes, hypertension, cardiovascular disease, and other lifestyle-related chronic diseases. I am often asked for my views and advice on natural ways to lower high blood pressure. This is because of my interest in lifestyle medicine and also because of my work in conducting lifestyle and diet modification training programs, as well as my experience in helping and guiding my patients with high blood pressure in the holistic management of hypertension, including and especially in the area of modifying and improving their lifestyle and eating habits to better control and combat their hypertension. However, in this video, I would not be talking about the different natural ways, non-pharmacological ways to lower blood pressure. In this first video of the series, I only want to focus on one very important thing, which is the number 1 mistake, the biggest mistake that I see many people make when they choose to lower their high blood pressure naturally instead of taking medications. Let's imagine a scenario whereby you have just been diagnosed with hypertension and your doctor is suggesting to start you on high blood pressure medications, but you're not keen on taking medications and are more inclined to try natural means to lower your blood pressure instead. What would be the biggest mistake that you think you might make? In my experience, the most common and also the most serious mistake that people with hypertension might make, is this: that you make the avoidance of taking blood pressure medications as your primary and main goal. That because of your strong desire and preference to utilize natural means or non-pharmacological means to lower your blood pressure, you flatly reject the idea of taking medications, even if that means walking around with suboptimally controlled, poorly controlled, or even dangerously high blood pressure. This is something very common that I see amongst people with hypertension, that many are so fearful of, averse to, resistant to the very idea of taking medications for hypertension, that they would immediately and flatly reject their doctor's recommendation and prescription for blood pressure medications totally, even though they have been unable to control their blood pressure through natural therapies or non-pharmacological means despite their best efforts to do so for some time, or that they never even had any intentions, any plans in the first place to change their lifestyle and diet to improve their blood pressure control. They just simply did not totally reject the idea of taking any medications for hypertension, even if that means walking around with poorly controlled, dangerously high blood pressure that would lead to sudden or long-term serious complications. Or even if they agree to the prescription or using drugs to help them better control their blood pressure, they would have very poor compliance. They would not take their blood pressure medications regularly as prescribed, even though their blood pressure are still poorly controlled or even dangerously high. Many might even go into a phase of denial or avoidance. They would stop measuring or monitoring their blood pressure or even stop going to see the doctors altogether. It is almost as if they think by not measuring, not knowing their blood pressure, then they would not have high blood pressure. It is almost like saying that if you don't test for disease, then you wouldn't have to deal with the disease. I have encountered many people who, because of their resistance to and rejection of taking blood pressure medications, walking around with very poorly controlled, dangerously high blood pressure and doing nothing about it. And I worry for them, because that might lead to sudden, severe complications. At this point, may I ask you not to be too quick to jump on me and say, of course, you are a medical doctor, therefore you are always going to be pushing the use of drugs. The first and only thing you do for people with hypertension is to prescribe them with blood pressure medications, because that cannot be further from the truth. For those people who know me, they would know that that is certainly not me. I am a practicing medical doctor. Prescribing medications for hypertension is definitely not the only thing that I would prescribe to my patients with high blood pressure. Because even though I might prescribe blood pressure medications if that is necessary and clinically indicated, I would also always prescribe lifestyle and dietary habits change to all my patients with hypertension. And I would do that through a series of hour-long consultations and coaching sessions over many months. I am a very passionate and strong advocate of lifestyle medicine, of using lifestyle and dietary habits change to better control and combat hypertension. In fact, I'm always telling people with hypertension, regardless of whether they are my patients or not, that lifestyle and dietary habits improvement to lower overall cardiovascular risk is a must-do, regardless of whether they are already on blood pressure medications or not, regardless of whether their blood pressure are already brought under good control with medications or other non-pharmacological means or not. In my medical practice, I focus a lot on helping my patients, even if they are already on blood pressure medications, whether prescribed by me or by other doctors that they are also seeing, to make changes to their eating habits, to reduce their overall cardiovascular risk, improve their blood pressure control, monitor their blood pressure closely over time, over months. And when we see improvements in their blood pressure, consider reducing or even discontinuing their blood pressure medications when it is medically safe and clinically indicated to do so. So, if you have hypertension and despite your best efforts have been unable to bring your unhealthily high blood pressure under control through natural, non-pharmacological means, or if you were found to have dangerously high blood pressure at the point of first diagnosis and your doctor recommend that you start taking medications immediately to bring your blood pressure under control in a timely manner, you should not flatly reject the idea of taking blood pressure medications, even though you want to. You prefer to lower your blood pressure through natural, non-pharmacological means. I strongly recommend that you have an open conversation and thorough discussion with your doctor to better understand the full implications of poorly controlled high blood pressure. Work with your doctor to develop a holistic plan, including taking medications if that is deemed necessary to adequately control your high blood pressure in a timely manner to minimize risk of sudden serious complications, but also to lower your long-term overall cardiovascular risk. And at the same time, especially for those of you who do not like the idea of being on long-term or even lifelong medications for hypertension, you should not wrongly think that simply by agreeing to start medications for your hypertension would mean that you would necessarily have to take medications for life, that you would definitely never be able to get off them. I want to encourage you that as you change and improve your lifestyle and diet whilst you are on blood pressure medications, you might see improvements to your blood pressure over time, over months, as your new healthier lifestyle and diet take effect and kick in to improve your blood pressure. And then, in consultation with your doctor, there is still a chance that your doctor might be able to reduce or even, in some cases, discontinue your blood pressure medications. But again, I cannot emphasize this enough. Work closely with your doctor. Never reduce or stop your medications on your own without consultation with your doctor. In conclusion, utilizing lifestyle and dietary habits change to holistically combat hypertension is not just an adjunct. It is not just a good to do. It is a must do in holistic optimal hypertension management. So if you have hypertension and you want to fully explore natural, non-pharmacological means to control your blood pressure instead of solely and overly depending on blood pressure medications, you should still not make the mistake of being too quick to dismiss or reject the use of medications if your doctor thinks that it is necessary to bring your unhealthy, dangerously high blood pressure to safer levels in a timely manner, even as you continue to work on natural, non-pharmacological ways to improve your blood pressure control. You should also not make the mistake of being too quick to reject the use of medications to be part of a holistic plan to achieve more optimal control of your blood pressure, especially if your blood pressure is still not adequately, not optimally controlled, despite your best efforts to practice and utilize various natural, non-pharmacological means to control your blood pressure. You should not deem yourself a failure if you fail to control your blood pressure optimally through natural means, despite your best efforts. Because your most important goal in hypertension management should not be about avoiding blood pressure medications at all costs. Your goal should be to maximally lower your risk of developing the many serious and debilitating complications of long-term, poorly controlled hypertension. And if that means the need to use blood pressure medication to some degree to help you achieve that, then you should at least consider that in discussion with your doctor instead of flatly rejecting it. I hope you have found this first video of my ongoing series of videos on lowering blood pressure naturally useful. If you'd like to be updated whenever I upload new videos, do consider subscribing by pressing the subscribe button below. Thank you for watching. I am Dr. Chan. Let's unlock the power of habits. One habit, one dose at a time. Take care and have a blessed day.